I've been an oncology nurse for 23 years. And for 23 years, this has been my life, oncology. And to become an oncology patient in a second blows you away. I really didn't have symptoms. I probably had about 3 episodes in a 6-month period where I noticed just a small streak of blood. And I thought, oh, you know, I must have an internal hemorrhoid. I had them when I was pregnant. I thought nothing of it. I certainly would be the first one to call the doctor if I thought something's up.
When she was 50, she went to get her screening colonoscopy like everyone is recommended to receive. And unfortunately, they found that despite the lack of any real symptoms, she not only had cancer, but she had some locally advanced cancer with spread to the lymph nodes.
I think the first thought was, I can't believe this is happening. She was young. She's a oncology nurse, and I don't think we ever contemplated her facing the exact thing that she worked with.
Good girl.
So it was traumatizing.
My dad died at 52. He missed my whole lifetime. My daughter was getting married the following June. I had to make it. And I met with Dr. Breakstone that Monday morning. And she is a take charge kind of girl. She's like, Michelle, this is what we're gonna do.
After Michelle finished her chemo and radiation therapy, she was set up for removal of her rectum, and we were able to reattach the colon down to where the rectum used to be. We had to do a temporary diverting ileostomy for her, which she had for about 8 weeks.
How you used to go to the bathroom before changes. Patients need to be guided to, for instance, our ostomy clinic, where people are trained to handle stoma, and if it's temporary, it could be temporary for 6 to 8 weeks, but they need to be trained and made comfortable with this.
They can mark a perfect spot for the stoma to help with management afterwards, and then they're available after being in the hospital to follow up and deal with any issues.
I don't tell all my patients, but the ones I feel that need help the most, I'll say, I've been through this and this is how you're feeling, and I can appreciate that. And when I'm done, they're like, oh my God, I can't believe you've been through this. I feel so much better. Because they want to know, they want that reassurance that they're in good hands and that someone else has walked this walk.
Screening programs work, especially when the disease process takes a while. Polyps take at least 7 to 10 years to turn into cancer.
Colorectal cancer is a very tricky disease. The symptoms can often be very minimal and can overlap with other types of diseases. If you're having bleeding or pain, those are times where you really need to get checked out and not just put it off and wait for it to go away.
The colorectal cancer program we have at Miriam is very strong. In addition, we have a multidisciplinary clinic where all of us get together at least weekly, and every single one of our rectal cancer patients are discussed in this multidisciplinary tumor board before they even start their treatment.
They need someone to follow them for their diet, for exercise, treating your bowels, because it runs your life. You know, it is so hard mentally to keep yourself together through the treatment and know at the end of the road you're going to be okay, but when you have to worry about your family and providing for them and not being able to work, that's a whole different ballgame.
There are even more challenging issues with this particular cancer because a lot of those long-term issues might be related to things that are uncomfortable to talk about or even to think about. Issues like bowel patterns and sexual dysfunction. financial toxicities. So there are a lot of long-term impactful changes that happen after a colon cancer, even after cure.
It's so lucky. My husband was unbelievable for support. I'm so fortunate. I have the love and support of my family.
Michelle being in the field, we could have gone to Boston, we could have gone anywhere. She knew the quality of care that they were able to provide, and they've been excellent, and they still are excellent. We still work with them.
Who better to care for me than my coworkers? Really, I feel safe. The professionalism, they're so caring. I have the best doctors. I had the best nurses taking care of me. Inpatient, outpatient. I've been at Miriam, I'm going into my 30th year. From the CAT scan department to the operating room, recovery, 3 North. I was so proud to have been an employee of the Miriam for the way I was cared for, honestly.
It's wonderful to see Michelle every day and be reminded constantly that the care that we have provided is part of the reason that she is thriving and back to work and back to as normal a life as one can have. And I sincerely believe that she is going to be a survivor and here at the Miriam Hospital for another 20 years.
Love you. I love you too.